Hello, everyone. Thank you for joining us for this second webinar of the series, I Was Born, I Exist, and Add Me to the List. My name's Mia Dambach. I'm the Executive Director for Child Identity Protection, and we're very pleased to be working with ATD Fourth World as they lead this webinar series with African Child Policy Forum, UNICEF, and my own organisation. So in this webinar series, we're working with the hardest to reach populations, those living in poverty and the obstacles that they face in getting a birth certificate. And I'm really, really pleased to have today the participation of children, youth and adults experiencing poverty, in particular the Tapuri Children's Parliament in Bangui in the Central African Republic, who is a main area that ATD Fourth World is working in. And to give these children's parliament a voice in a language that they're most comfortable in speaking in, we will have interpretation from French to Sango. And before we start this webinar, I'd like to just start with a bit of housekeeping. Firstly, you'll see at the bottom of your screens that there is a possibility to have interpretation. There will be French to English. That will be provided by Christine Welch and also Maëlle Blivet. And we will also have, as I mentioned earlier, the interpretation from French to Sango, and that will be provided by Jeffrey Garner. So thank you to those interpreters for your work. I know that that's not an easy task. What we will also have today are two sessions. One will be focusing on the Central African Republic, and then we'll have a second session working on the region Africa. At the end of this session, we'll have about 20 minutes for questions and answers, but you can already start including any questions and answers that you might have by looking at the button on the bottom of your screen and adding questions. If you have a question directed to the Youth Parliament, you need to write question for the Youth Parliament or question for ATD Fourth World or question for whoever it is, and we'll do our best to answer that question. So without further ado, in terms of the webinar itself, why are we choosing Africa and why are we looking at regional developments in this context? As many of you know, there are over 200 million children under the age of 5 that do not have a birth certificate. Over 90 million of those children are in the sub-Saharan Africa and they're not registered. Latest statistics show that every day 115,000 babies are born on the continent, and 57,000 of those children go unregistered and therefore lack a legal identity. So achieving universal birth registration is a global priority which has specific significance for Africa, given the rate of children that remain unregistered. Why the Central African Republic? Why are we zooming in on this continent, on this country? It's because it is one of the places where ATD's Fourth World's team is working very closely on the ground, working with families living in poverty, working with the Youth Parliament. Today, we're really lucky, and you'll see them very shortly. Christopher, Profina and Herman from the Tapuri Youth Parliament. Then you'll also hear from Joel Kapandi, who is ATD Fourth World's activist and supporting families with specific work to ensure that they can have access to birth registration. So that will be, and then we'll have the pleasure of having Mylene Tudera, the Director of Civil Status and Demography from the Central African Republic, from the Ministry of Territorial Administration, Decentralisation and Local Development. So that will end our first segment. Following that first segment, then we'll zoom out in terms of regional perspectives. And again, we're very, very fortunate to have Samarawit Getana, the legal researcher working with the African Committee on Experts, Rights and Welfare of the Child Secretariat, working very closely with the Special Rapporteur, Honourable Karuna, who's working on the named birth registration, the right to nationality. And then we will close with Nankali Maksud, who is the Senior Advisor of Child Protection for UNICEF East Central, SR Eastern Southern African Regional Office, and she'll be presenting on their latest report, Every Child Counted, and specifically focusing on people living in poverty. So without further ado, I'd like to give the word and place to Christopher. So Christopher, can you tell us a little bit about the Youth Parliament? You have the floor. Thank you.
Merci. Bumbi Tamengeti Parlement a commencé à l'âge de 8 ans à on dit 16 ans. À partir du 1er novembre 2020, la Bangui a quitté so a kuja ati ke Congo Batamengi so kenati yere et la tabo na trois combats. Défendre le droit des enfants, être avec des enfants qui n'ont pas d'amis, ne laisser aucun enfant en arrière. Et il s'amène plaidoyer dans petit hôpital pédiatrie, dans l'hôpital Seni, soit qu'il y a un outil mi veni, dans ton tani, il y a un hôpital pédiatrie, dans ton somme qui a son terrain, mais qui n'a maladie, il n'est erni, à midi parlement, avant mi dans quartier, mi dans parlement, mais, à mon dieu, quand il y a des dés, le gros ami, le parmi, parlement, et le gars, ami, parlement, qui n'a pas animateur quand on a la pédiatrie, à Gona, ils sont 10 000 avant de faire l'opération. Et il y avait des pays, mais il gagne dans le parlement, il y a un midi, alors le parlement, il y a un docteur, il y a un plaidoyer, docteur, il a opéré, il y a un gars, il y a un copain, il y a un ça. Et puis, ça m'a plaidoyer, la vérité, école Nicolas Barré. Nathan nous allons à amitié dans la Cristiano de bonheur à l'école cette école-là. Ma soeur est cette école-là. Et dans le là, il doit ça plaidoyer. Ami la mingi so kana mbeti singwa pe. Alors wa lege tite alors kwa école na beta pas na mingi. Il pour la école ni et puis mi kwa chose c'est pour l'école et puis la chose pour mbeti. Meni amitié il a mbeti fini école passer à tumba na mbeti singwa pe. Et puis na pe quand il a visite na mbeti amengi swala kinayati pale pale ti ongu ti santé ti éducation et puis na entré dans la zone salé ala rive pepe ti u na terrain ti salé nyonso kitoko be ala yeke e ngba e gue na mbege ti député Rachel na mbi ambenge ti parlement ni e gue e na lo tene lo gue atëë ni na biron ti kota. Merci.
Donc, merci Christopher pour votre intervention. C'est très important votre travail que vous faites. Maintenant, la parole à Bayo Ptefina. Chef Ptefina, vous avez la parole.
De Matiamo Lingiti Parlement, Kutamama Tenechimbi Ake Use, aujourd'hui avec Tenechimbi Tingusto Ami Lingiti, avec Nabeti Tingwa Pesi, ala Ida Chibuchi, na a communauté tongana kokoro voix du cœur na saradasi ala kodema na azuchi tango beti chungu tisano chungu na molenge so aiki na beti chungu ape ala sara amenge majorité chala ala bénéficie na beti chungu ngana useteneni aiki na ndo chipi kango patara so amolenge ti parlement ida chipi ka patara lani na a journaliste so isa kota point de presse so atende na beti chama soki na yaki yere inga atapande tatongana na koko so atente na ndo ti seni so aleke na problème inga na ala soki na ti yere na yati ala na gbe ti mustike abesi ngu ate ala wara palu inga na useni atente na ndo ti so ala sa ate na ndo ti protection ti amolenge so ayeke yo anengo ye so na poati ala mpe amama ke maltraita mingi na façon so anjera mpe aya otani atente amolenge ti kula so atete na ndö ti mbi na ndö ti akumbi musulman na chrétien ti duti ako si ala sara tapu ako achangement so après aga na bikoni amama so alimbi ti maltraita mingi ti ala achange nga na ala so ayeke zosa te na mbeki ti mpongo so gouvernement mu yanga titene azokosa te kape na ala sika.
Un grand merci aussi, vous, Bayop Fefina. Et maintenant, nous avons le dernier délégué du Parlement de jeunes, Tapori, chez Herman. Vous avez la parole.
Bon, quand tu veux le monde, peut-être, attends, tu veux moi, ça passer, même, quand ça a passé, bien, na kandi, ala onde, bon, minga, tout ça, vous tapez, attends, tu ada mula za gisa gwana bigat kinen amna ga bigat kinen ka bombi asan ke ba amda wala so ba chiyo kada ba ka fondation ba chiyo ka bo apa ati ka mo aka ko asara te ti apa histoire ntai ti livre bombi ka ni mandina ni asi ba nuna bo batambe akamba pa tamda kamba para mote ke baso mbira biga bunda para mote minga ti tene et puis minga ti but mi etan du droit taminge et puis ke ya tendi ka ko baso ka sa tale ta tasu pa tambla. Merci.
Merci à vous, Herman. Thank you to all the three delegates of the Tapuri Youth Parliament. We can see that they're doing fantastic work in their schools, making sure that children have access to their very basic rights, including the right to an identity, the right to an education, the right to a birth certificate. And thank you for everything that you've done also to prepare for today. I know that there were a number of sessions beforehand to make sure that this was a smooth running and that you have communicated very well your work and your desires. I encourage you to continue this work for your community and for the Central African Republic. Thank you for being an inspiration to other children and to us as we continue to try and make sure that every child has a legal identity. Next, we'll hear from Joel Kapanji, ATD Fourth World activist, who is working in the Central African Republic, who co-chairs the Administrative Document Commission that is supporting families living in poverty to ensure that they have a birth certificate. À vous la parole, Monsieur Joël.
La commission de administrative réunit les militants, les volontaires et les élus dans le but d'accompagner les familles en situation de grande pauvreté dans les démarches de l'identité légale qui est l'acte de naissance. L'acte de naissance est impératif pour cette famille et qui bloque le processus pour que ces familles puissent avoir l'acte de naissance de leurs enfants. C'est ainsi que nous, la commission, on a jugé bon vraiment de mettre cette commission pour accompagner ces familles-là. Les enfants nous disent que sans avoir un acte de naissance, c'est comme si tu n'existais pas. Et cette parole nous a beaucoup touchés et qui nous a amené vraiment à mettre cette commission en place en date du 31 janvier 2023. Et nous avons organisé plusieurs activités et nous avons tissé aussi des partenariats avec le ministère du Territoire et de décentralisation locale où nous avons signé un contrat de partenariat. À l'issue de ce contrat, on a eu aussi à faire un contrat au niveau du service technique de l'Union européenne qui est CEPIBOL, qui est la mise en œuvre de ce projet gouvernemental pour délivrer 100 000 actes de naissance. Et à l'issue de ce contrat, nous, Commission ATD Carmon, on a eu à bénéficier de 218 actes de naissance au profit des enfants qui vivent dans des situations très difficiles. La Commission a eu aussi à organiser des activités de sensibilisation et de mobilisation que nous avons organisées pour que ces familles connaissent aussi les démarches d'obtention d'actes de naissance que leurs enfants pourraient en avoir. Également aussi, nous avons identifié beaucoup des enfants dans des quartiers environnants pour que nous puissions entamer à faire leur identité légale aussi. Il y a certains enfants aussi qui vivent dans des situations difficiles, des enfants de rue, où leur démarche est tellement très compliquée. Pour un enfant de la rue, il faut aller dans un centre de santé pour qu'on puisse avoir ce qu'on appelle un certificat de carence. Pour un enfant, il faut payer 2000 francs. À l'issue de ce certificat de carence, il faut aller maintenant au niveau du tribunal pour enfants pour payer 5500 francs pour chaque enfant et avoir ces deux documents, certificat de carence et le jugement, pour aller déposer à la mairie pour qu'on puisse avoir l'acte définitif. Et le problème qui se pose, c'est que la loi prévoit que nous pouvons avoir une semaine d'avoir cet acte de naissance, mais des fois, on peut en avoir 1 à 2 mois pour qu'on puisse avoir cet acte de naissance. Et je crois qu'on a beaucoup accompagné ces enfants, ces familles qui nous parlent de leurs difficultés. Il y a certaines familles qui accouchent dans la communauté. Et pour que la matrone traditionnelle puisse lui délivrer le bulletin de notes, et cette femme matrone-là n'a pas l'habilité de donner un certificat de naissance. Et ce qui bloque aussi le processus pour une famille d'aller au niveau de la mairie pour obtenir l'acte de naissance de leurs enfants. Et je crois ce défi, cette problématique qui nous a beaucoup poussé pour qu'on puisse accompagner ces familles-là. En conclusion, il serait souhaitable que le travail mené par cette commission, que ça soit reconnu et valorisé pour le reste de la société. C'est dans cette optique que nous lançons un vibrant appel aux organismes internationaux qui œuvrent dans ce domaine d'état civil, d'appuyer et de valoriser les efforts des familles qui vivent dans des situations de grande pauvreté pour mettre fin à la violence et à la misère. C'est vrai, la responsabilité incombe de ces parents-là, qui sont les responsables excellents pour leurs enfants. Nous remercions également les différents partenaires qui sont proches de nous, qui nous poussent aussi à marcher, à accompagner ces familles-là. Et nous remercions aussi le ministère du territoire pour que cet lien soit renforcé pour que nous puissions atteindre encore d'autres familles qui vivent dans l'ombre. Merci.
Thank you, Joel, for your work. Thank you for everything that you do with families to overcome these many, many barriers that they have to ensure that they have a birth certificate. It's fantastic that you can work with the Administrative Commission, and what I think your presentation shows is that we need to come up with creative ways to make sure that we get the hardest to reach families and the hardest to reach populations, and this is one of those examples. So thank you for your work. And now I'd like to invite our final speaker for the Central African Republic, Madam Mylene Tuadeda, who is the Director of Civil Status and Demography. Thank you for taking the time and thank you for the work that you do. Over to you.
Oui, bonjour. Bonjour à tout le monde. Je suis Madame Mylène Touadéra, directrice de l'État civil et de la démographie au ministère de l'administration du territoire, de la décentralisation et du développement local.
Oui, vous pouvez continuer, Madame. C'est à vous de faire la présentation maintenant.
Je pense que le gouvernement a d'abord modifié le cadre juridique sur l'état civil en associant la gratuité de déclaration et d'obtention d'actes de naissance des enfants de 0 à 6 mois par l'article 18 du Code de protection de l'enfant. Et aussi la création des centres d'état civil secondaires dans les zones reculées. On a aussi l'organisation des campagnes. On a organisé des campagnes de rattrapage de déclaration de naissance au profit des Peuls et des Pygmées. Et aussi, on a organisé les campagnes de rattrapage spécifiques pour les délivrants des actes de naissance et des jugements supplétifs. D'actes de naissance délivrés, d'actes de naissance. Exemple, en RCA, on a délivré 3000 d'actes de naissance, jugements supplétifs aux Peuls et aux Pygmées. Je ne sais pas si vous m'entendez.
Oui, madame, on vous entend. C'est excellent, votre présentation et vos œuvres, mais vous pouvez continuer sans autre.
Ok, d'accord. Et aussi, on a la signature des accords de partenariat avec les organisations de la société civile en vue d'accompagner le gouvernement. Cas de ATD Monde, NRC, OIF, etc. Il y a aussi l'organisation de recensement administratif à vocation d'état civil au profit de toutes les personnes vivant en République centrafricaine, les nationaux, les étrangers, comme cela se fait au Bénin et au Mali. On a aussi, bon, dans tout ce qui se fait, il y a l'ignorance de certains parents sur l'importance d'actes d'état civil. Et il y a aussi la réticence de certaines mairies à appliquer cette gratuité et la corruption dans certains services. Il y a aussi l'éloignement de certaines populations des centres d'état civil et les coûts élevés de leur déplacement jusqu'aux 10 centres. C'est ce que je pourrais dire. Et en plus de cela, on a notre politique d'état civil que les grands axes, que nous travaillons sur les grands axes. Et en plus de cela, il y a le décret d'approbation qui a été signé, qui accompagne cette politique. Il y a aussi le plan de communication, notre plan de communication qui est déjà en place. C'est ce que je pourrais vous dire. Merci.
Un grand merci, madame Touadera, pour votre présentation. C'est très encourageant de voir toutes les manières, toutes les initiatives que vous avez mises en place pour assurer que chaque enfant puisse avoir un acte de naissance. Les campagnes, les systèmes de rattrapage, d'enregistrement de naissance et déjà 3000 enfants qu'on peut profiter de ces œuvres. Nous vous félicitons pour ce travail. And so now we come to the end of our first segment, looking at the work of Central African Republic, the activities of the Tapori Children's Parliament, the specific activities of ATD Fourth World, and also the government with the presentation of Madam Tuadeda. What I suggest is that we'll have a very 1-minute break before we start and zoom out and start looking at the more regional context, where we will have a representative of the working in the Secretariat of the African Committee on Experts in Rights and Welfare of the Child. So we'll come back in 1 minute and start this second segment. And then we'll end with some questions where the participants feel free to add your questions in the questions and answers section, and then we will be able to have some conversations. And I think some of the Dapuri Children's Parliament, the children themselves, have some questions for some of the experts prepared. So we'll be back in 1 minute. Thank you. So after that little pause, we're now back for our second segment, where we'll hear from Samrawit Getana, who's the legal researcher who works very closely with the Special Rapporteur on the Right to Name, Birth Registration, the Right to Nationality, Honourable Karuna, who's currently working on a report for the Committee on Birth Registration and Digitalisation. And then she'll be followed by Nankali Maksud of UNICEF on the key takes from their latest report, Every Child Counted. So over to you, Samrawit. Thanks for making the time to be with us today.
Thank you very much, Mia, and good afternoon and good morning to everyone. I'm here on behalf of Honorable Karunawati, who is the Special Rapporteur of the African Committee of Experts on the Rights and Welfare of the Child on Name, Nationality and Birth Registration. And I'll talk briefly about the work of the committee on the topic and give a general continental overview of the rights and also the obligations of states in relation to birth registration. So the African Committee of Experts on the Rights and Welfare of the Child is established by the African Charter on the Rights and Welfare of the Child, which is a regional child rights instrument or law that is ratified by 51 African countries. The only 4 countries that are yet to ratify the charter are Morocco, Tunisia, South Sudan, and Somalia. So the charter under Article 6 guarantees that every child has the right to a name, to acquire nationality, and to be registered immediately after birth, along with the corresponding obligation of state parties to fulfill these rights. And then the committee monitors the implementation of these rights through state party reporting procedure, where each state that's ratified the charter reports to the committee every 3 years on measures taken to implement this right by interpreting the provisions of the charter, including Article 6 on the right to birth registration, through its general comment, and by promoting it through its special rapporteur's mandates and through communication and individual complaints, which are cases that come to the committee alleging violation of the charter, including violation of the right to birth registration or nationality. The committee consistently emphasizes that birth registration is a fundamental right that is essential to a child's legal identity protection and in general for the full enjoyment of a child's human right. Its work particularly evident in its general comment on Article 6, which is an elaboration of the content of the right and the content of the obligations of states, and specific decisions such as a decision that it gave to Kenya as well as Sudan in relation to cases brought to it alleging violation of this right in different ways, highlights this comprehensive approach to advancing birth registration for the hardest to reach populations and those living in poverty. And its approach is generally guided by universality, non-discrimination, and accessibility, along with a strong focus on preventing statelessness. So one of the first things that the committee addresses is poverty and financial barriers. The committee explicitly identifies poverty as a significant factor contributing to low birth registration rates in the continent. And to counteract this, birth registration rates must be free of charge. But this extends beyond merely abolishing the direct registration fee, but also any kind of indirect fee associated with birth registration. For instance, birth registration cannot be considered free if, for example, prohibitive transport fees prevent access to civil registration offices. So the committee encourages variable fees for late registration with reduced rates especially in rural areas. Additionally, birth registration desks should be established at all points where a birth certificate is required for services, for instance, in school enrollment, in social security or poverty alleviation program locations, to facilitate registration when non-registration becomes apparent when a child goes to access those services. The second one is ensuring universality and non-discrimination for vulnerable groups. The principle of universality dictates that birth registration must be afforded to all children without discrimination, irrespective of their legal status or the legal status of their parents or primary caregivers. So the committee stresses that discrimination on any ground undermines this principle. Vulnerable groups are specifically identified as requiring special protection measures for registration. The Kenyan Nubian children's case serves as a crucial example of the committee's intervention in relation to marginalized ethnic groups. Nubians in Kenya face systematic challenges, including parents lacking valid identity documents, which complicated their efforts to register their children at birth. Even when birth certificates were issued, they explicitly indicated that they were not proof of citizenship, leaving children in very ambiguous situation. A major point of contention in this case was the arduous and unreasonable and de facto discriminatory vetting process, which was applied to Nubian children for nationality acquisition. And this process required them to wait until the age of 18 to apply for nationality, which the committee ruled that is a violation of Article 6 and a child's best interest, as children should have nationality immediately after birth and also be registered immediately after birth. The committee in this case found multiple violations of children's rights, including non-discrimination, concluding that the differential treatment was not justified and constituted racial and ethnic discrimination. The denial of nationality had consequential violations on other fundamental rights, such as access to education, healthcare, exacerbating their vulnerability and leading to systematic underdevelopment of an entire community of Nubian population. Another group of vulnerable population in the work of the committee are refugees, internally displaced persons, and asylum seekers. And birth registration is considered a special protection measure when it comes to this group of children. And states with a large number of refugee, internally displaced, and asylum seeker children are encouraged to bring civil registration services closer to camps and settlements through temporary offices or regularly organized mobile services. Birth registration of these children provides legal recognition and identity, but it doesn't amount to granting them nationality. However, it's crucial for later on nationality claims and helps prevent statelessness. And denying registration to this group of children is an act of discrimination. Another group is children of undocumented migrant status, or that come from parents of undocumented migrant status. This group of children, of course, must also be registered at birth without discrimination. And states here should explore non-documentary evidence of parental identity to prevent intergenerational cycle of non-registration. The system should guarantee confidentiality to irregular migrants, ensuring that details are not shared with police or immigration authorities. This way, to encourage registration or to ensure that parents and caregivers do not shy away from registering their children out of risk of being deported. Children born from indigenous parents are also recognized as vulnerable in terms of registration. They often face extreme poverty, they lack awareness, and they're usually suspicious of authorities. There's also language barriers and distance to registration offices. especially for those living a nomadic lifestyle, which leads to very low, extremely low registration rate among this group. And states here must implement explicit legislative and administrative measures that specifically target indigenous children, including awareness creation campaigns, outreach programs. Again, here mobile registration systems are useful in nomadic communities and recruiting staff who can communicate effectively with them. Children with disabilities and children of parents with disabilities are another group of vulnerable population. Here states must take special measures to ensure that registration of children born with disabilities or from parents with disabilities, increasing their visibility for specific policies such as education policy, healthcare, and social grants. For children born to parents with disabilities, specific attention is needed, including using community leaders for identification and reporting, adapting registration materials, and training registry staff in relevant communication methods, for instance, sign language. Another group is children of imprisoned mothers. Registering these children makes them visible, enabling imprisoned mothers and also imprisoned primary caregivers in general. This makes them visible, enabling their protection and the right to survival and their education and all other human rights. Another focus of the committee is prevention and reduction of statelessness as a core objective of birth registration. This is a central aspect of the committee's work to reduce statelessness, particularly for children. Birth registration is a key form of proof linking a child to a specific state, which helps them ensure a nationality and prevent them from becoming stateless. The committee emphasized that states have a specific obligation to confer or to give nationality upon a child born in their country if that child would otherwise be stateless. The impact of statelessness on children is, of course, devastating. It limits their access to constitutional rights, freedoms of movement, justice, healthcare, education, and many others. In the case that the committee received against Sudan and it rendered a decision, it highlights how the arbitrary revocation of nationality, as seen in the case of children of South Sudanese origin who are living in Sudan, can render children stateless and deny them rights such as education, dignity, family, and protection. So the committee's ruling in this case underscores the devastating impact of such arbitrary actions on children's rights. The obligation to prevent statelessness, which is under Article 6 of the Charter, as I said, is an obligation of result, meaning that states must take all necessary measures to prevent a child from having no nationality. The practice of making children wait until the age of 18 to apply for nationality, which was practiced in Sudan, specifically for children linked with South Sudan, is not in line with Article 6 and also the best interest of the child, and was seen as a violation of the Charter. In general, states must take proactive action and ensure capacity building to implement this right. And this requires states to take various measures, for instance, establishing and maintaining decentralized, efficient, and effective civil registry systems, conducting widespread education and sensitization campaigns, implementing continuous training programs for all stakeholders, which includes civil societies, legislators, health workers, law enforcement agencies, and also adopting comprehensive, up-to-date legislation that complies with the provisions of the Charter, as well as other relevant international law, and specifies procedures, costs, access, privacy, and prevention of fraud, aligning with the general comment of the committee, which elaborates on the elements of the right to birth registration. Implementation of this right and guaranteeing that every child is registered at birth and is protected from statelessness is, of course, a very resource-intensive endeavor. Hence, it's very crucial to address the resource question. This is not a question that only is limited to the issue of birth registration, but cuts across all child protection issues in the continent. So given the crisis that we are in now, the dwindling of resources for social protection and the debt crisis that many African countries find themselves in, it's important to connect the advocacy work that we do in this regard and with the issue of resources. So where do we get the resources? Where do we ensure that the resources are available to take all of the above listed, as well as other measures that states must take to ensure that every child is registered and is protected from statelessness. Thank you very much.
Wow, Samrowi, that was a fantastic presentation. I think that the interpreters had a bit of a challenge catching up with all the dense information, but maybe you have something written that you can share later, because it was very, very rich in terms of the cases that you talked about, Sudan, Kenya, and talk about all these different types of vulnerable groups, the hardest to reach, and many of these groups will be living in poverty. And so I personally found it amazing. It could be a concept note already, a mini publication, but it would be really helpful if you could share that so that we can share it with the participants and further on in terms of the work. And if you could stay on, because we probably have some questions for you at the end of Nankali's presentation. So without further ado, we have our last speaker today, and thank you to Nankali, who's kindly agreed to speak during her leave. But thank you for that you will be speaking about the key takes from your latest report, Every Child Counted. And it's not specifically on children living in poverty, but it has a number of implications if states are to implement it properly. Especially for me, I look at the decentralization. Decentralization means getting to the hardest to reach, not just those living in capital, but those that may not have access to these civil registries. So over to you, Nankali. Thank you again. Oh, and Nankali, if we could just speak a little slower, because the interpreters have been saying to me, Mia, it's hard for us to get the French interpretation right. Thank you.
Okay. All right. No, thanks so much, Mia. Can you confirm that you can hear me?
Yes. Yes.
All right. Fantastic. It's nice to come in, right at the end after hearing all the rich presentations from everyone. I'm really happy to be able to have this opportunity to speak to everyone today, and particularly enjoy the fact that we have the Tapori Children's Parliament together with us as well. So maybe just a kind of quick intro, and Mia, you already made reference to a lot of this. The situation in terms of child protection, and Frannis, please go to the next slide for the first one for introducing. Maybe that's hanging a bit, but I've got it on my presentation, is that, we're all clear, and I'm sure that's why everybody has logged on today, that birth registration is a gateway right. It unlocks for us many things, and a lot of people have spoken about that today: access to education, access to healthcare, to protection, and most importantly, of course, to legal identity. This situation, unfortunately, for us who are living in Africa, is that millions of children in Africa remain invisible to government systems due to lack of registration. And I really like that the Tapori Children's Parliament really highlighted many of the things that are blocking children from being registered on the continent. While that was very specific about CAR, I think it reflects many other countries on the continent as well. We also know that unregistered children today face heightened risks in terms of exploitation, in terms of statelessness and exclusion. And I think Samarik did a really good presentation of that, especially, for example, talking about Nubian children who are living in Kenya. So the challenges that we're facing is that, despite many global and regional commitments, the specific region that I work in, which is the Eastern Southern Africa regions, continues to report some of the lowest birth registration rates in the world, and of course in Africa. Africa as a continent has low rates of birth registration, but my particular region is really challenged in this way. And so for us, we took it on as a challenge to say, what are these things that are blocking children from being registered? And so some of the things that we identified there is, the legal barriers, late registration, penalties, very closely linked to the issue of poverty. If you have poor families and then you penalize them as well for late registration, that definitely impacts, on them. Documentation burdens, geographic inequities, so the issue of, families living in rural and underserved communities, really impacts in terms of their access to registration. Technology limitations were also a key issue that came up as well. As we look at the opportunity on the African continent of shifting out of paper-based systems towards digitalization, that again also impacts in terms of poverty because, for example, quite basically, if you don't have a phone, if you don't have computers, it limits your access. Issues of conflict and displacement, these are on the increase in the continent, and we know that fragile states and humanitarian contexts continue to disrupt the systems that will be able to register children. And then finally, just institutional fragmentation. We have weak coordination between ministries and lack of integrated systems, and that impacts especially on poor families. So you can imagine a mother who is giving birth in a hospital who should be able to access all the services at one point, goes back home and has to come back to a different institutional place for her to be able to register her children. That impacts significantly on her capacity to be able to access those systems and for children to be able to access registration. The good news is that we have good practices. Many of the member states that we have across the continent are doing a good job. So for example, in Namibia, we have mobile-based birth registration. We have strong legal frameworks, which are taking away, for example, some of the cost-related issues that we have. In South Africa, we have, interoperability with systems so that, if a mother, as an example, is going into a health center, she can not only be able to give birth or be able to ensure that her child gets vaccinated at one point, but it also ensures that she's also able to register her child at the same point as well, which minimizes her need to travel the next day, minimizes her transport costs, etc. So there are ways in which we can be able to put policies in place to reduce the impact that this has on poor families. In Mozambique, we have community-based outreach. So we're, looking and identifying where it is that we have poor families and ensuring that these mechanisms, can be able to reach out, mobile outreach into those communities so that families who are far away, pastoralist families who are made reference to, we can be able to reach out to them and ensure that they can be able to access these services. Integration with child grants is another methodology of how we can ensure that poor families can be able to access. For example, where families are going to be able to access, funds through grant mechanisms, we also ensure linked onto them, we can be able to bring in birth registration. And then in countries like my own, Tanzania, we also have simplified birth registration systems and again, decentralized services. So it's clear for us as a continent today what type of policy options we need to be able to provide to ensure that we reach the most vulnerable communities and those who are most poor. The issue that we have as we go forward is what's our drive to ensure that these are in place so that every child on the continent can be able to access birth registration. So for us as UNICEF, we have developed a vision and goal that by 2030, every child in East and Southern Africa is registered at birth and has legal identity. It is our goal to be able to support member states to reach 95% birth registration coverage across the region by 2030. And the region for us is, East and Southern Africa. Now, how are we going to be able to do that? I've already referred to the policy options that I think work. While this strategy was developed for us within the East and Southern Africa region, the strategies that we're going to put into place, are evidence-based, and it really doesn't matter whether you're in East and Southern Africa, Central Africa, West and Central Africa. This is what we know as a continent that can ensure that we register all children. And we've learned this not only, from program experience, but also from evaluations. And so the paper that Mia made reference to has also played a big part in terms of informing us on what it is that works to ensure that all children are registered. Number one, I've already made reference to is this issue of interoperability. We must connect CRVS systems with health, with education, with protection. If a child goes to school, don't let that just be a place where they go to school, but ensure that they can get registered. If a mother goes to give birth in a hospital, don't just let that be a place where she just gives birth, but let's ensure that she can also get her child registered there as well. If parents are going off to get national ID systems, we know now, for example, on the continent that this is a big favorite area in terms of investment around national ID systems. Again, how do we take advantage of that same point where parents are getting national IDs to ensure that they also get birth registration for their children? Decentralization, I've already made reference to. We simply cannot be a continent that ensures that these services are only available in urban cities or in urban capitals. We have to go out and reach the people. The majority of the population in Africa live in rural areas, and we need to be able to reach out to them to ensure that they can be able to access these services. And children are registered, and we know who they are, where they are, and can be able to provide the right services for them. Digitalization is kind of a double-edged sword, but I think it can work. It's been shown to be able to work. We're using digitalization, for example, in Namibia, through mobile-based birth notification, demonstrating how digital schools can be able to streamline registration. So if you can use it to simplify the process, if you can use it to be able to reach those who are most vulnerable, those who are poor, it's something that really certainly will be able to pay off. Now, these are the three strategies that we have in mind and that we think would definitely make a contribution, especially on poverty-related gaps or barriers, excuse me, for ensuring that all children access CRVS. Additional things, of course, that come into mind is partnerships. I'm speaking here on behalf of UNICEF today, but nobody can be able to do it on themselves. It will take broad partnerships, just as in the same way that a number of institutions have come together today to ensure that this webinar is in place. It will take us and many more to be able to come around the table and say that this is important, this is what we want to do, and each one of us bring in our comparative advantages to ensure that we're delivering on birth registration. So having those partnerships for us is going to be very, very important. And so finally, my call to action, we're looking to governments to continue to lead, invest, and track this. Are we heading in the right direction? What lessons are we learning? And how do we make the necessary adjustments to ensure that we are registering all children, not just some of them, but particularly those who are most vulnerable, and people will tend not to be able to remember those. We also want communities to step up and help to drive awareness, to highlight to everybody that this particular population hasn't been reached. And here are the ideas, the thoughts, the options of how we can be able to reach those who are most vulnerable and those who might be poor. There's something in this for everybody to be able to play a role. And for us as UNICEF, we believe that this is a right. It is a right through the African Charter, through the CRC, and many of our countries in the continent have made commitments toward this, and we can be able to deliver it. We just need to be able to have the will and the interest to be able to prioritize this, and all can be done. Thank you so much, Mia. Back to you.
Thanks, Nankali. Always great to have you present on the work that UNICEF's doing and some positive, promising practices on how to get it done, because we can spend a lot of time talking about the problems and the obstacles that the hardest to reach populations face, but I think that we need to move forward. And there are some fantastic solutions that are highlighted in this report. But now, this is the first webinar I've ever attended, everyone, where we're ahead of time and that we actually have time for a real discussion. So I'm very excited about that there will be ample time for discussions. So well done to all the speakers for keeping to time, even ahead of time. What I'd like to do is give the floor to the Tapori youth. I think they have some questions for the speakers, for Madam Tuadweda, Samrawit, and Nankali. They have some questions for you. And then once they've asked their questions and you've had an opportunity to answer those, then there are some questions in the question and answer box, and we'll see if there are other questions. And then I have some questions if we have time. Let's see. Over to you, Pfeffina et Christophe, à vous pour poser vos questions, si vous voulez maintenant.
Ma question est celle-ci. Comment les autorités peuvent valoriser les voix des enfants?
Super, merci. Donc, Madame Tuadeda, ça c'était une question pour vous. Vous l'avez entendu, la question? C'était comment on peut valoriser la voix des enfants avec les autorités. Et maintenant, à vous, Christophe, votre question pour, je pense, c'est pour Samrawit et Nankali.
Tongananye, alimbiti mu maboko na mulingiti taporis.
OK.
Comment est-ce que les enfants parlementaires pourront être soutenus et participer aux réunions au niveau régional organisées par l'UNICEF, l'Union africaine et les autres? Merci.
So Nankali and Samrawit, if I can just give you that question, it's really about how can we ensure at the level that you're working in, at these regional instances, how can we ensure that the voice of children is included and how can they participate in these types of settings? Okay, so donc Madame Touadjada, à vous d'abord pour répondre à la première question de Trefina.
Oui. Bonjour encore.
Bonjour, on vous entend.
C'est Prafna qui a posé la question.
Vous voulez que je dépose la question?
Oui, oui.
Oui. C'est comment les autorités peuvent valoriser les voix des enfants, comment ils peuvent participer au niveau gouvernemental et comment vous pouvez les inclure dans les différentes initiatives que vous êtes en train de mettre en œuvre.
Bon. Je pourrais dire le gouvernement est en train de mettre en place des mécanismes pour pouvoir intégrer ces enfants-là dans tout ce que nous faisons, dans notre service état civil. Leur donner la chance d'avoir accès à l'acte de naissance parce que c'est un premier document. C'est vraiment nécessaire. Si l'enfant n'a pas un acte de naissance, il ne pourra pas aller à l'école, il ne pourra pas faire ce qu'il veut, quoi. Donc, le gouvernement est en train de mettre en place beaucoup de mécanismes pour ces enfants-là.
Excellent. Merci beaucoup, Madame. Now the question for Samrawit and Nankali about regional initiatives. Maybe for you first, Samrawit, and then Nankali.
Thank you, Mia. Could you please rephrase the question one more time? I was typing an answer to a question on the
Excellent. No problems. It was just more about how can children participate in regional initiatives, including at the African Committee and also the initiatives that UNICEF SRO or WCARO is involved in.
All right. No, thank you very much. So at the committee, child participation, the charter itself mandates us to ensure that there is meaningful child participation in everything that we do at the committee. So we have a child participation guideline in which is public document, which you can find on our website, which details how children participate in all our mechanisms. So when a state report comes to the committee, we encourage civil societies to work with children. And sometimes we have, in addition to the CSO parallel reports, we have children's reports. We have countries such as South Africa, which through their children parliaments and other child participation mechanisms at national level, gather children and actually write a children's report that reflects on the state report itself. So state party reporting mechanism has that component. In terms of bringing cases to the committee, in the communication mandate, children can bring cases directly to the committee. A child in Central African Republic whose rights have been violated, who tried to access national legal systems to have their the violation remedied and failed to do so, can bring the case to the committee. And it may seem very complicated, but it's actually not that complicated. It's a matter of writing an email to the committee with all the documentation that that shows the violation, as well as the efforts at national level to go to the national courts. So we have various cases that civil societies work together with children and bring cases on behalf of children, but we also receive directly cases from children, even though so far we have not had that. And if we do receive a case directly from a child, we offer assistance in terms of fine-tuning the legal arguments and all that. In the sessions of the committee as well, we make sure that we always have child representatives in every single panel, in every single activity, that we have a child with a lived experience who comes and tells us on any topic that we engage with. So we have a very robust child participation mechanism, and I don't want to take too much time, but I would invite all of us to look at the child participation guideline to see how we involve children, and to also a call for all of us here to help us directly interact with children, because we don't have a presence on the ground in the different countries. We're based in Lesotho. We don't have presence in all the African countries, but we work with civil societies to make sure that we directly get the voices of children who are affected by any issue that we're working on the highest level of policy discussions.
Thanks for that, summary. But maybe if you have an opportunity, if you could put a link into the chat in terms of the child participation. And then Carly, the same question for you.
Okay, thanks so much, Mia. So just adding on to what Samarit has shared, it's also important to UNICEF. Of course, our mandate is linked around children. And so whether you're meeting with UNICEF in Eastern Southern Africa or in Western Central Africa, child participation or children's engagement is a key principle for us. And Mia and others, it doesn't start for us at regional level. In fact, for us, regional level is probably where it has least emphasis. A lot of our work on child participation really is centered where the children are situated, which is in country. UNICEF has one of the greatest footprints across Africa in terms of UN agencies, and across all our countries, we have extensive child participation activities that are going on in terms of ensuring that children engage in policies to be able to support countries to develop policies around birth registration. So we support that at country, and we don't only do that in the capitals, we also go out into the community. So there's active participation at decentralized levels as well. And then we take also that knowledge and bring young people also to regional platforms as well. So that participation then also serves upwards at continental level and at regional level as well. So just to say that we think it's important, we support it. And for us, it doesn't just start at regional, it moves from country at decentralized level into the capitals and up to regions as well. Thanks so much, Mia.
Thanks for that, Carly. Now, if I look at the questions that are in the question and answers, there is a question also for Joël. Joël, il y a une question pour vous qui pose comment on peut assurer que vos œuvres soient pérennisées et institutionnalisées comme les initiatives communautaires, notamment les actions des enfants parlementaires. Comment on peut assurer que ça ne reste pas juste à Capitale, mais que tout le pays peut profiter de votre travail. Et il y a aussi Michel Besset qui voulait vous remercier pour votre magnifique travail en plus. Donc, à vous la parole, Joël. Il y a une question pour vous, Joël, c'est comment pérenniser vos efforts?
Nous avons des réunions et nous convoquons aussi des familles, nous faisons des panels pour que nous puissions déceler surtout le processus d'obtention de l'acte de naissance. Donc, c'est en famille, ensemble, que nous organisons ces panels-là pour qu'ensemble, que nous puissions accompagner ces familles jusqu'au processus d'obtention de l'acte de naissance. Oui.
Merci, Joël. Maintenant, j'ai une question pour les enfants. Le Tupuri Parlement des enfants. Il y a une question pour vous. Qu'est-ce que vous voulez dire aux parents, aux enseignants, aux d'autres personnes responsables? Qu'est-ce qu'ils doivent faire pour assurer que vos droits soient respectés? Donc, Christophe, Pevina, c'est des questions pour vous. Peut-être je vous laisse réfléchir un petit moment et je donne la parole de nouveau à Samarit et Nakali et après on revient vers vous. Comme ça, vous avez un petit moment de préparer la réponse à ça. Samrawit and then Carly, there is a question for you. I saw that Samrawit, you already started replying to this question, but I think it's a really important question. I saw that you typed an answer, but I think it would be great if you could also explain this during the webinar. What do you see are the benefits and risks of digitalization in birth registration? For you first, Samrawit, and then Nankali, because then we can really go deeper into really the benefits. There are many benefits, but there are also some risks in when it's not done in a way that respects children's rights. Samrawit, do you want to go first?
Sure, Mia, thank you. Yeah, I had started to summarize this a bit in the chat. So as you said, there are many benefits, but also there are many risks. And we have seen both a bit of both manifesting already. And the committee is currently working on a guidance note to have a comprehensive guiding different stakeholders as we continue to digitalize. Digitalization is something that we're not going to stop. It's going to continue. So I think first, what's important for us to think of is the energy gap in the continent, the energy challenge in the continent, meaning that electrification is still a long way to go to ensure that everyone has electricity, first of all. And digitalization and electrification must go hand in hand together to make sure that there's already a digital divide between those who are connected and between those who are not connected. And one of the underlying factors is the energy gap. Not everyone has access to electricity. In most African countries, the access is very challenging and the progress is very slow, while digitalization is going fast, while a lot of services are being digitalized without being mindful of the fact that people don't even have electricity. So one of the biggest risks is deepening the digital divide that we already have. That should be factored in. And digital technology could come with pre-existing biases. Whoever is designing the digital tools, if we don't ensure that those who are designing these tools are inclusive, they have that inclusive mentality and they have inclusive in design, then they risk perpetuating the already existing types of discriminations that we see in the world, in our societies, which are not yet digitalized. But on the other hand, it offers also various opportunities. We've seen that accessibility is a big issue when it comes to birth registration. So if we use digital tools, especially tools that are called low-tech tools, or that don't require us to have a smartphone to access some kind of services such as SMS or USSD services, we have seen that these kinds of low-tech solutions can enhance access to areas that have limited internet connectivity, even limited electricity connection. Artificial intelligence technologies can also assist, for instance, in language translation. Language is a huge barrier in various communities, in indigenous communities, various kinds of marginalized ethnic groups who don't access services because of this language gap. And if AI tools, of course, if we make sure that in design they are accessible, they can reduce this gap in accessibility. And well, there are various opportunities and risks, and I know that Nankai had also touched on this, perhaps, so she can perhaps elaborate further because she has touched on this in her presentation as well.
Thanks for that, Samrawit. Over to you, Nankali.
Thanks so much, Mir, and thanks, Samarit. I think the issue of power, electricity, on the continent is a key one, and I hadn't even thought about that until you mentioned it. Mia, I think there's no escape in terms of digitalization of CIVS systems or of most systems, on the continent, and it's not just on the African continent, but globally today. There's no doubt, around the things that Samrat has raised in terms of increasing coverage, in terms of increasing, accessibility, efficiency, speed. All of those things are there and cannot be denied. And even when we're talking about cost savings in the long run are going to go down. It's going to also ensure transparency and accountability. So I think there's no doubt in any of our minds about the advantages of digitalization. But the issue is that how do we ensure that as this happens, because we can't run away from it, it happens in a way that ensures inclusion. We see the risks and they have already begun. Exclusion and inequality are really high up there. Families without internet, without smartphones, or literally skills are basically going to be left out. And so how do we ensure that as we take on this opportunity, we also build capacity amongst our communities and especially those who are in vulnerable areas so they can be able to gain from what this could possibly be able to bring to us. Technology infrastructure also remains a key challenge for us within the African continent. And so that's what Saramit has already referred to, the issues of power supply, connectivity, server downtimes, especially in rural areas. That really continues to be a key issue for us. Data, I don't want to take up too much time, but issues of privacy and data concerns are also very key up there. We're going to be providing all the information of who we are, where we're born, who are our parents, who are our grandparents sometimes. All that information is going to be centered somewhere, and there'll be key issues about what somebody can do with that type of data. And how do we ensure that, that data is private, that data is secure, and that data isn't used to manipulate, to exploit, etc. So there's some key issues up there that we really do need to be able to think about. There's no way for us to run away from this. So how do we design it in a way that ensures that everybody is able to benefit from it? Thanks so much, Mia.
Thanks for that, Nankali. I know that there is someone that will be working with the children in terms of the question that was raised for them. But in the meantime, there is another question from Benama Zakri, who is the coordinator in Maroc on civil registration. And his question is, and I'm not sure who to pose this question to, but it is a question about cross-border movement of civil registration, civil status documents. How do we ensure that these procedures are coordinated? And so I give it to both Samarawit and Nankali. I know that the International Commission on Civil Status, they had their General Assembly today. Their conventions are also very helpful because they're doing this cross-border private international law recognition. But maybe Samarawit and Nankali, you also have something to say. Samarawit, first to you.
Sure, thank you, Mia. I think this is also connected with the previous question because one of the pros of digitalization is exactly this, the transfer of data across borders. It makes cross-border coordination easier if done in the right way, and it makes sure that the legal identity of children is protected and there's a continuum throughout their movements, both internally in their countries, but also across international borders. So one way to ensure an effective cross-border coordination is making sure that we use digital tools for efficient communication. But in addition to that, I think one of the challenges in relation to this, both across border, but even internally, the same challenge applies, is the silos, the different stakeholders, government stakeholders who are responsible for different aspects of this are not talking to each other. So the line ministries dealing with children, the line ministries dealing with migration, the border control, they don't speak to each other and they have different interests. And one key recommendation that the committee has been repeating over the years is that these stakeholders must speak to each other if we are going to have an effective child protection across border. If border control doesn't talk to child protection units, then we have a problem. So one of the best practices in relation to this is this one-stop centers at border posts, because most of the movement happens, majority of the movement happens on land. So one of these one-stop centers have been a good case practice in some countries that have established it to ensure that there is this communication, but leveraging on the digital tools is something we can work on.
Thanks, Samarit and Nankali. I don't know if I'm putting you guys on the spot, but
No. Mia, this is a big area of work that we're working on right now. Just to say that, we are a continent that encourages movement, but movement to a point. So we have lots of people moving within the continent, and in fact, more within the continent than outside the continent. And increasingly what we've seen, Mia, over the last, I'd say maybe decade, is a lot of children are moving by themselves, which is really unfortunate. And as they move, they need to be able to be recognized in the states that they pass through, and they need to be able to ensure that they can be able to access services. The unfortunate thing that we're seeing across many of our African countries is that they are not recognizing these children, because step one would be to either recognize their foreign birth certificates or to issue them certificates for the countries in which they are entering into. And in many of our countries, unfortunately, the global mood today, and not just, in Africa, I think everywhere, is that, countries are blocking this type of movement. Countries are ensuring that migrant populations, and especially children by themselves, not especially, but including children, cannot be able to access birth certificates, because once they're able to access those birth certificates, that means that they then have a right to education, they have a right to health services, etc. And so a big part of the work that we're doing in terms of refugees, in terms of asylum seekers, in terms of migrants, is to see how to advocate that these children don't remain undocumented, the children plus the parents, but that they can be able to get documents, and birth certificate is up front, and in terms of importance of what they need, this is really high up there, so they can be able to access services into the different countries as they come across. And so Samarit has talked about the borders and how we can make those borders work. We have pastoralist populations as well. For us, Mia, it's not just people cutting borders, but we also have pastoralist populations just freely moving around as they should. And as they do that, we want to ensure that they can be able to access services. And again, the issue of birth certificates just comes back to, to us in terms of it's important. It's something that we need to do. It's a rights-based issue. And so we're continuing to advocate for this issue. But just to say, the global mood, the continental mood, everywhere that you go in nowadays, is that most people are shutting down their gates and not ensuring that as these populations come in, as children come through, they can be able to access this important documentation. Thank you.
Thanks for that, Nankali. You can see that we have the leading experts speaking about this topic, so it's really great that you guys can answer these questions on the spot. Maintenant, je vais revenir vers les enfants avec la question qui était posée par Michel Bess, qui était, avez-vous une question ou un message pour les adultes? Qu'est-ce qu'ils doivent faire pour que ça aille mieux pour vous, pour que vos droits soient mieux respectés? Christophe.
Message me dit mou en étant so, mais dit tene à côté de dit qu'endroit à ton là UNICEF na
Nous
Union
invitons à ce
africaine.
que nous lançons un message à l'endroit des autorités, à l'endroit de l'UNICEF.
Amu maboko na plaidoyer soko isa ati de golani na
Pour
dawa
la
et ati
en
na
compte des
kota
plaidoyers que nous
et puis
menons
pour
auprès de
seigneur
ces
so
autorités.
na ndo soko ya kota de kota dawa la militaire a iti timbe la pousse à parentine ndiata melenge so avec
Et nous
IR.
lançons aussi un message à l'endroit des autorités locales pour qu'ils la prise en compte de nos doléances et puis aidons des sensibilisations auprès des parents pour le respect des droits des enfants.
Leida a plaidoyer na a pané tout ça mais il
Parce
aussi
que
à la
les
golani na dawa
plaidoyers et les
tika kota.
panels restent le seul moyen pour nous de faire passer nos messages.
Merci.
Je vous remercie.
Merci, Christophe. Et Sefina, est-ce que vous voulez dire quelque chose aussi? Non, OK. Et Herman, est-ce que lui veut dire quelque chose ou non, non plus? Non, OK. Mais c'était bien. Merci, Christophe, d'avoir répondu, sauté dans le brèche avec cette réponse qui était très claire. Maintenant, ce qu'on va faire, c'est, on voit que on a 10 minutes encore et je pense que ça serait bien si on finit avec qu'est-ce que chaque État, parce que c'est quand même les États qui ont cette responsabilité d'enregistrer les enfants, quel est votre dernier message? So, what is your final message? I'm going to ask from Joel to Samrawit to Nankali to Madam Tuadeda. What would be your message to governments? And maybe for Madam Tuadeda, what would be your message to your partners? How can they help you? How can they help your government to make sure that every child is registered? Starting with Joel, what would be your message for governments, Joel, in terms of what should they be prioritizing for birth registration? I think you just need to turn on your microphone. Yeah.
Merci pour m'avoir donné de la parole. Mon message se situe au niveau du gouvernement d'abord, que le gouvernement de notre pays puisse vraiment mettre en application les lois qui régissent la gratuité d'avoir d'acte de naissance pour tous les enfants qui vivent dans des situations très difficiles. Et avoir aussi la possibilité vraiment dans les arrêts de pays, des structures de la mairie qui peuvent donner une chance à cette famille vraiment qui vit loin de Bangui, loin du pays, pour avoir l'accès à l'acte de naissance, puisqu'il y a une rareté des structures de la mairie, de l'état civil, dans des endroits reculés. Et vraiment que ces familles-là puissent vraiment avoir accès vraiment à avoir aussi l'acte de naissance pour leurs enfants. Et aux partenaires, je crois que c'est vrai, la commission administrative travaille sous ce nombre, on n'est pas tellement valorisé, on n'est pas tellement reconnu, mais cet partenariat entre nous avec le ministère, que ce soit renforcé et que nous puissions vraiment aller de loin pour identifier aussi les enfants qui sont dans l'arrière pays pour que eux aussi ils aient la chance d'avoir l'acte de naissance. Je vous remercie.
Merci Joël pour cette observation. Et je pense qu'il y a pas mal des avocats sur cette webinaire. C'est très important que ces lois soient mises en œuvre. Madame Tuadera, la question est pour vous maintenant. Qu'est-ce que vous pensez? Quelle est votre recommandation à vos partenaires pour assurer que chaque enfant soit enregistré? Et j'ai vu qu'il y a deux autres questions qui viennent d'arriver dans le questions et réponses. La deuxième question, c'est comment vous allez, est-ce qu'il y a un moyen pour que le mère puisse déclarer son enfant à l'absence du père, et surtout dans l'environnement que le transhumance et la migration. Est-ce qu'il y a comment les mamans peuvent enregistrer les enfants quand il y a ce mouvement qu'ils doivent déplacer dans le pays, ils peuvent pas enregistrer les enfants tout de suite. Ça, c'est une question
Oui,
pour vous.
merci.
Mhm.
Oui, merci. Ce que je demande aux partenaires financiers et techniques, c'est d'aider le gouvernement à enregistrer les enfants à l'état civil. Parce que deux fois, il y a un problème de moyens, le manque de moyens, et aussi l'éloignement des mairies, des centres d'état civil. Il faut que le centre d'état civil soit rapproché, hein, auprès de la population. Donc, c'est ce que je demande à nos partenaires.
Oui. Et est-ce que vous avez aussi, ça c'est une bonne requête, mais est-ce que pour cette question que j'ai vue dans le questions et réponses, est-ce qu'il y a moyen pour les mamans pour déclarer leur enfant à l'absence de père? Quand le papa il est pas là, est-ce que la maman peut enregistrer son enfant seule?
Oui, bien sûr, oui. Les mamans peuvent toutefois déclarer la naissance de leur enfant auprès de la mairie. Prenons le cas des Peuls et Pygmées. Les Peuls et les Pygmées.
D'accord.
Ça peut toutefois le faire. Ça peut se
Excellent.
faire. Mm.
Super. Merci pour cette clarification. And now we turn to Samrawit in terms of what would you recommend to states in terms of how they should accelerate birth registration, and then we finish with Nakali, and then we'll be finished the webinar, this very interesting and comprehensive webinar. Samrawit, over to you.
Yes, thank you, Mia. I would say that to states, I think it's already been said a few times, but that this is a right, and then they have a legal obligation. It's a legal right, and they have a legal obligation to register children at birth. But beyond that, states should also see this as an opportunity. In Africa, I think 70% of the population is under 35 years old, and we always talk about harnessing the demographic dividend, but we don't even know who they are. It first needs to start by knowing what is the demography, and that starts by registration at birth. So I think this is an important message to governments that I think we should also incorporate in addition to it being a right and an obligation. It's also an opportunity for states to ensure that we harness the demographic dividend in the continent. And I would also like to extend to civil societies and to different partners that the committee, and as well as specifically the special rapporteur, has a very wide mandate. It's a mandate that is not really well exhausted. One, because of lack of resources to undertake this awareness creation or on-site investigation and the likes. But another, because lack of engagement from civil societies on the ground. So it's a call for civil societies here and beyond, and partners, to bring information to the attention of the special rapporteur on the committee, first-hand information from those on the ground on different aspects of this, whether it's a violation, whether it's a good case practice, whether it's a recommendation, so that the committee carries this forward, specific context-based information, data, messages, so that the committee takes this forward to ensure accountability from states whenever it engages with states. Thank you very much, Mia.
Thanks for that, Samrawit. And then Carly, for the final words.
Yeah, thanks so much, Mia. It's been really good to be able to be on this webinar today. I think, it's been very good to be able to have the Tapori Children's Parliament. For me, children have a right to be seen, to belong, and to be protected. And I think you can't do those three things unless you start off by registering them at birth. I think the continent has been very clear. We have, an Agenda 2063. We followed up with an Agenda 2040. We're very clear about what we think is important for us as a continent, and over again in the key policy documents, governments have recommitted to the issue of birth registration. So going forward, I think we need to be able to come together as partners, and see how to be able to support these national programs. All our countries have national programs in place. We need to do this faster. We need to be able to reach the most vulnerable, and we know what the strategies are to be able to do that. So now it's just commitment and political will to make this a reality. Thanks so much, Mia.
Thanks, Nakali, and thank you again to all the speakers. Thank you to the interpreters. It was a lot of information for Sango, French, English, French. And thank you to all the speakers for your time and being here with us today. And a very special thank you to the Tapori Children's Parliament. I think that you're probably the highlight of this webinar, giving us real food for thought in terms of what you need, how we can better protect your rights in terms of birth registration, but accessing all rights. So thank you again, everybody. This webinar has been recorded. It will then be disseminated to all participants, and so people can re-listen to it. And thank you again, everybody. And good luck with all your work that you're continuing to do to make sure that every child is counted. Goodbye.